Welcome to Keep Them Coming. I'm your host, Kristen Thomas. I'm a certified sex coach and clinical sexologist, as well as a writer, inventor, and public speaker. I love to teach about sex and pleasure, but one of my deep passions is to talk to people about what goes on in their sex lives and relationships. Telling people stories, or having them tell their own story, helps normalize the taboo, break down barriers to desire, and allow all of us to have even better sex. Conversations on Keep Them Coming may include tales of long-lost love, gender journeys, entrepreneurship, community activism, queer history, kinks, and consensual non-monogamy on top of the adult sex ed. Don't worry, there's plenty for the self-described vanilla crowd on these episodes as well. Having said that, dear listener, you should be 18 and over, and probably listening on your headphones. You can also watch Keep Them Coming on my YouTube channel. Thanks for tuning in. Today's guest is Pamela Merritt. She's an American writer and reproductive justice advocate who advocates for women's rights and against white supremacy. Merritt is the executive director for Medical Students for Choice, a nonprofit with a network of over 10,000 medical students and residents around the world. She has been in this game for a while. Before this role, she co-founded Repro Action, a reproductive justice organization that works to increase access to abortion, expose deceptive practices at pregnancy crisis centers, and improve infant and maternal mortality rates. She has been a longtime advocate for doulas and midwives to improve birth mortality rates. She's been published everywhere. She's been in Washington Post, NPR, Rolling Stone, Vox, and Huffington Post. If you follow Jessica Valenti, you may have also seen Pamela recently interviewed on her Substack newsletter. She is also a member of the Guttmacher Institute's Board of Directors, the Leadership Council of Our Bodies, Ourselves Today, and is the honorary chair of the Repro Action Advisory Council. She is a St. Louis native, and I am so thankful my friend Crystal helped make the introduction for us. I interviewed Pamela previously in a 2022 article I wrote for the Pitch magazine that was looking ahead at what was the world going to look like in a post-Dobbs world. All this to say, she's a total badass, and I was very honored to have her as my guest on the show today. On today's episode of Keep Them Coming, I am joined by someone who I interviewed a few years ago for an article for the Pitch magazine, getting an update post-Dobbs decision. But I'm very happy to, for the first time, have Pamela Merritt on the show. So welcome.
Thank you so much for having me.
So your organization is Medical Students for Choice. You're the executive director. Tell the audience a little bit about what you all do.
Yeah, happy to. So Medical Students for Choice was founded in 1993 by medical students, shortly after the assassination of Dr. David Gunn, who was an abortion provider in Florida. So the organization that the murderer in that case was a part of sent a mailing to thousands of medical students, basically threatening them with the same outcome if they continued to pursue abortion training and education. But their response was confusion, because for many of them, they weren't actually getting a very thorough family planning, reproductive health foundation at the med school level. So part of it was getting, your life threatened for something you're not actually receiving. And then the other part was, to have somebody of all of the things that people experience and are studying in med school, the only thing they're getting their life threatened about is women's reproductive health care. So the awesome medical students who founded MSFC decided that they wanted to advocate on the campus level for curriculum reform so that the curriculum would be more uniform and would include, as part of the core, reproductive health care, including abortion. And then it's grown to also include abortion trainings. We actually host abortion training institutes 3 times a year. And then we do trainings at the chapter level. And we also support each chapter's individual advocacy, whether it be for emergency contraception on campus or for more rigorous abortion training on campus. And the final thing that we do is we do externships, which is MSFC will match a medical student or resident with an opportunity to train at the clinic and learn directly from a provider. So yeah, we've been doing this for over 30 years. We are in 30 countries across the globe.
Oh, wow.
Our largest membership is in the US, but our fastest growing membership is in the global South.
Very good. Very good. Yeah, reproductive healthcare access is definitely shifting in the global South. I know just from some travels, there's a lot of stigma around sexual health and reproductive health, mostly because the facts have been withheld. So it's lovely to see that is an area of growth, because we do know that reproductive health care saves people's lives.
Exactly.
So, let's get a little political, a little philosophical here. But, I mean, why do you think it is that so many people don't understand, they don't connect the dots between abortion care, reproductive health care, and how it's life-saving? I want to make an instance here. My mother had an ectopic pregnancy, in fact, 2 after me. It took me until my adulthood to understand that what she had to save her life was an abortion. We just always kind of labeled it as, oh, well, she had a miscarriage and she got the care that she needed. But why do you think there's such a disconnect between these two things?
Gosh, probably our puritanical roots in America.
Yeah.
But 1 out of 3 people who are capable of getting pregnant are going to seek an abortion in their lifetime. So it's far more common than major dental surgery, and it's safer. It's one of the safest things that people, type of care that people can seek. But we don't talk about it because we view an unintended pregnancy as something shameful. And that doesn't matter if it's a traditional marriage and that happens, and it doesn't matter if it's just a free range woman out there in the world who happens to get pregnant. We view sexual expression and entitlement as something shameful for women. And that has infused every area of our healthcare to our detriment. The United States has the worst pregnancy outcomes in the developed world. So there's no benefit to acting as if people don't have sex, to acting as if pregnancy is not a consequence of sex. There's no benefit to not talking about the complications of pregnancy openly, but we also don't talk about the full spectrum of reproductive health care. I'm 52, and so many people did not tell me about menopause. And I'm hopeful that my generation...
As a perimenopausal woman, I'm like,
Yeah. So, so many people haven't really talked about it. And I hope my generation will be the one to kind of break that habit. But I do think there's a lot of stigma behind how somebody gets pregnant. And that stigma infuses what they determine to do with the pregnancy. So the fact that we don't respect women can't be separated from the fact that we don't respect the choices that they make.
Yeah, could not agree more. Well, and I think one of the unintended consequences that some of these folks who are wanting to ban reproductive health care are not understanding is that as you ban abortion and you don't recognize it as reproductive health care, you're going to create issues for people who want to start a family or who get pregnant at whatever their circumstances. And I want to use Idaho as an instance. There's a lot going on up there. It's a very messy state, but one of the things they're starting to see is that OBGYNs are leaving the state. So what does that mean for pregnant people?
So, as I said, we have the worst pregnancy outcomes in the developed world. And that was the case before Dobbs, where we already had a physician shortage that was definitely not helped in any way by the COVID pandemic. So all across the country, OB-GYNs are in high demand, and you're not guaranteed that there's going to be one near you. Abortion bans make it very hard to be an OB-GYN and provide reproductive health care. They make it harder for the OB-GYNs who do complex cases or high risk cases, because there's not a doctor that I've met yet who wants to accept preventable maternal harm as part of their daily practice. So it is the moral injury of asking physicians to accept somebody dying or losing their future fertility because over something that they could easily solve and prevent. And added to that are felony penalties in many of these cases. So if you're in Idaho, you're facing an aggressive state and local prosecutorial environment. You're seeing people who aren't getting treated. They're not healthy when they're getting pregnant. They're not getting prenatal care the way that they should because there's not enough health centers. And you're also seeing people who have high risk or dangerous pregnancies later in term. So it's the perfect storm. And interestingly enough, with Idaho, I don't know if this is still the case, but for years, they actually had protections for death as a result of faith healing. And so they have a long history of Pentecostal evangelical sects in Idaho, and they weren't treating diabetes, they weren't treating other things. And there were protections legally. You couldn't prosecute these people. But in this case, we are doing the flip, which is we're looking at a physician and saying, I'm going to prosecute you if you do proven medically centered, patient-centered care. So they have every reason to flee. I think Idaho's a perfect example of making it impossible to practice, and that's before you even consider the insurance coverage that you have to have in a state with felony penalties. The how hard it is to get insured as a physician under those circumstances.
It's a sad, sad state of affairs. I mean, there's a lot wrong with Idaho, if I may just throw that personal judgment of mine out there.
Yeah.
All the white nationalism, things like that. I've traveled to Idaho for business, and
I haven't.
Don't bother. Don't go to Pocatello, Idaho.
No, it's on a list of states I will not be visiting for all of those reasons.
Yeah, I don't blame you. All right, well, camera issues aside, so I would like to talk a little bit about Missouri, what we've got going on here. So the state of Missouri, the voters of Missouri in November decided to overturn the state legislature. But now the state legislature is basically saying a big fuck you to the people. They're doing everything they can to overturn. So what do you know about what's going on in Missouri currently?
Oh, gosh, the first part of that answer is today is March 13th. And so it could change tomorrow. There literally is a hearing, I think, in Cole County today. So right now, just to rewind a little bit, in November, majority of Missourians voted to put protections for abortion and reproductive health care into the state constitution. So that's where we enter into the phase of what's legal and what's not legal. And courts determine what's legal. And even though based on the wording of that constitutional amendment, you certainly could make the case that an abortion provider could dispense medication abortion right now in any part of Missouri. What they would face is the potential of prosecution, and through their prosecution, they would then establish the law. That's just the way the American system works. So even though that constitutional protection's in there, there's a reluctance from reproductive health providers, and specifically there's 2 Planned Parenthood affiliates that operate in Missouri. They need to figure out how to clarify the law without putting their physicians or their practice in harm. So that's the world we're in right now. They've Planned Parenthood filed cases immediately following the passage. And it's important to note that those cases are still going. So there were initial rulings that struck down some of the penalties and some of the trap laws. These are targeted regulations for abortion providers. But those preliminary rulings didn't necessarily create an environment where people can provide all the abortions all the time. So the constitutional amendment does have viability language in it. And viability means very little when it comes to actual science. But I was part of an effort to try to prevent that from going into the ballot measure, but it did. So that means that the wording, for the first time, the state constitution says that the state has a vested interest in the healthcare decisions of a pregnant person at a certain date, which is not certain at all. So what we're looking at is the provision of care will not be for the full spectrum of pregnancy. It'll probably be determined by the state legislature, whether it's 20 weeks or whether it's 18 weeks. They can kind of define viability because viability hasn't been defined. The second thing that they're going to be working through is what is the complication plan. Right now, the reason that you're not seeing providers dispensing medication abortion is because their lawyers at Planned Parenthood interpreted the law to say that they had to send a complication plan for medication abortion to the state, and the state has to approve it. That is, again, an interpretation that may or may not be a conservative interpretation of the law, but either way, they're the providers, and they're waiting for the state of Missouri to officially accept their complication plan. So where we currently stand, if you are in the Kansas City metropolitan area, very little has changed for your life, because even though you can now get an abortion in Kansas City, Missouri, you could have still gotten an abortion in Overland Park.
Right.
If you are in the St. Louis metropolitan area or extending suburbs, then again, very little has changed. You could get an abortion at Fairview Heights. They may or may not be providing abortions up to 12 weeks at the St. Louis location. What has changed is that PP Great Plains, Planned Parenthood Great Plains, now is saying they're providing abortions in mid-Missouri. And that is a huge, wonderful thing, because it alleviates the burden of those patients on cities like city providers like the St. Louis clinics and the Kansas City clinics, who are actually providing care for up to 5 patients from up to 5 states.
Right.
So mid-Missouri, based on my most recent readings, is once a week and up to 12 weeks. So they are now providing abortion care, but they are not providing medication abortion care. And it is limited to up to 12 weeks. So here's where things get complicated,
Yeah.
which is the majority of first trimester abortions in the United States are now done through medication abortion.
Yeah.
So not having providers dispensing medication abortion isn't the best thing, but there are ways to access medication abortion either through telemedicine or through Plan C or other providers. Realistically, I don't know how many people would be going to Planned Parenthood for the provision of care. And when it comes to medication abortion, I'm not a provider. But what I do know is that we won't see an increase in access to abortion until we start to see an increase in procedural care past 12 weeks. Because most people in Missouri have solved for the logistics and have solved for access to medication abortion. But the reality is that the people who, made those initial headlines, the person who is having a miscarriage and being told to drive to Illinois from Springfield, those kind of stories are after 12 weeks. And most of the medical testing, genetic testing, can't even happen until 15 weeks.
Right.
So the fact of the matter is that people need access to abortion. People deserve access to the health care that they and their provider have decided. And people need that access not to be limited by arbitrary gestational weeks, because you never know when your life might be at risk, and almost always later in pregnancy, the future fertility of the pregnant person is at risk if they don't get care.
Yeah. The thing I've always maintained in arguments with pro-lifers is that we cannot legislate the entire human experience.
No.
We can't make exceptions for every single possibility. And that is why we had decided to just trust doctors and their patients to make their decisions. And I mean, like, we've been through this before, right?
Yeah.
The pendulum has swung this way before. And obviously people like us and others are out there fighting the good fight, trying to make sure we are all aware of what's going on, to also get boots on the ground. I know, like, right now people might be feeling like, what's it matter if I call my elected officials? What does it matter if I go to a rally? But, how can people actually take action at this point that can have a real impact?
I love that question. I think everybody who talks openly about abortion and reproductive health care is doing really, truly revolutionary work. People need to listen to the people who've had abortions or are seeking abortion. And the more we do, the more realistic our policy will be. What you described is this vicious learning curve that is so American, where we constantly have to relearn through hardship and trauma what was already solved, and so now you're looking at states like Missouri where, Mary Elizabeth Coleman, who's a politician.
Let me growl at her for a second. I cannot stand her.
He's horrible. But she's walking around for years saying there's never a need for abortion. And now she knows that 51 and probably more % of Missourians disagree with her. But more importantly, since Dobbs in 2022, we now know where it's not hypothetical. We can now show that we need abortion because sepsis cases are on the rise in Texas. We need abortion because people have died as a result of not receiving care and adequate care. We need abortion rights because the last place you want to decide whether you live or die is a hospital ethics board with a lawyer saying that we can't afford the risk.
Yeah.
And we need to trust women because, as you said, you can't solve for all the complications. I would actually push back a little bit. The best way to solve for all complications is abortion on demand without regulation. That solves for all the complications that can happen, and they are numerous. Very frustrating time, but I think people can talk about abortion. I think people make the biggest impact in their personal circles. The one thing that is hardest to do is to have conversations with the people closest to you. But those are the people who screwed up in 2016 and then did it again in 2024. You have people who voted for an abortion amendment and then voted for the people who banned abortion.
It made no sense. Our election results in Missouri made no sense. We voted for abortion rights and workers' rights and raising the minimum wage, yet we put an entire Republican slate of leadership back into office.
It's frustrating, but
and it's gerrymandering. It is. That's a part of it. But
Some of
some of it's also just gigantic misinformation.
and some of it is the absence of information.
Yes.
So what I would say is that people can't be held accountable if they weren't told. I firmly believe you have to be dead honest at the doors when you're talking to voters. And the way in which the abortion amendment was marketed to voters intentionally did not talk about don't vote Republican. I think that's a huge missed opportunity, but I wasn't a part of building that strategy. So people weren't told that if you vote for Josh Hawley, you're voting for the person who gave you this. And a lot of people don't see that. And so, we need to be more honest and more realistic. And I agree that abortion access and reproductive health care isn't partisan, but the people attacking it are. So we are not going to, right now in Missouri, because of the constitutional amendment, all abortion rights are now being held within the courts. And the courts are elected. So if you're not talking to people about partisan politics, then they're not going to know that that their rights are going to be held in a Supreme Court. That Supreme Court is at the state of Missouri. It was elected. And you need to make sure you don't elect people who are going to strike it down. Those conversations have long been overdue.
Agreed. I was telling everybody, don't retain these two judges. They try to keep it off the ballot. I think we ended up retaining them both.
Yeah.
Judges are one of those things I think that we don't talk about enough as we're coming up on elections, especially in
Big
Missouri. Time. A lot of my friends always say, I kind of just skip the judges section because I don't want to retain someone that shouldn't be, and I don't want to vote someone out that should be in there. I had to do a lot of research to go through the judges section.
It's hard. And just finding information. I think they intentionally don't make it really easy.
Yeah. I ended up going through and figuring out who nominated each judge. Ooh. But there was still one person that was a Democratic appointment that had a really bad score. I don't even remember which one it was. But
you can't just go off a party. In Missouri, you can't just go off a party.
No, you cannot. I remember kind of getting in an argument with online about like Jolie Justice supporting a pro-life Democrat, and I'm sorry, if you're a pro-life Democrat, I don't have room for you. I just don't.
You just don't make sense to me. No, because
you don't believe in bodily autonomy,
right? And it's all intersectional, right? Like if you're an anti-abortion Democrat because you support workers' rights, then you should be supporting abortion access because that's a workers' right issue. Absolutely. There's no part of policy is separate from people's ability to plan their pregnancies.
Yeah. For the listeners who might not draw the connection between those dots, how is reproductive rights a workers' rights issue?
Oh gosh, I love that question. So, as a worker, you have the right to health care. You have the right to a fair and livable wage. You have all of these benefits. One of the things that is being denied workers who can experience pregnancy in Missouri is access to the full spectrum of reproductive health care. Family planning is essential so that people can provide for their families, so that they can go to work. And in Missouri, so that people can be healthy. So many of the women I've met in Missouri who are working low-wage jobs are going back to work within a week or 2 weeks of giving birth. The maternal mortality rate in Missouri is indefensible. And it is directly connected to the lack of support that pregnant people get. So parental leave is a worker right issue, and the ability to plan your family is a workers' right issue. Breastfeeding and being able to do that within the workplace. That's the right of workers. And if we want to create an environment that is competitive, that environment has to include women. Women make entire job sectors competitive. But in order for us to participate in the workforce, we need access to the full spectrum of care.
Absolutely. Absolutely. I feel like a lot of people out there who are anti-abortion try to make the argument of, well, we're trying to go back to traditional family values. This concept of he works, she stays home. This
Which
traditional, it's
yeah,
bullshit. It's bullshit. It never
total.
existed. They
Never.
are trying to create nostalgia around a concept that never existed. I'm
No.
reading, I gotta look over it, The Way We Never Were by Stephanie Kuntz. Yeah, let's talk about that a moment.
Yeah, I mean, for women in my family have always worked. It's kind of like
Same.
when the nostalgia gets into becomes accepted, like the myth becomes fact, which is I had a teacher in college, a wonderful feminist who really broke it down. She had a rant she used to get on about it, where she said, you know, there's never been a war where women didn't fight. There's never been an economy where women didn't participate. And there's never been a struggle that wasn't won because women were a part of it. And if you can't conceive of that, then you're not really looking at history. So,
Right.
you know, some of our greatest union organizers in history were women, and some of the most amazing victories were won through women. And they talked, you know, Emma Goldman always talked
I was just
about,
thinking Emma Goldman.
yeah, Emma Goldman was always talking about the connection between access to birth control and women's liberation as workers. So, yeah, I mean, I think yeah, it's amazing how easy it is for people who know that their grandmother worked, but they are thinking that she shouldn't have had to. And for women, what we're fighting for is the right to be able to say how I want to live my life. If you want to stay home and raise a traditional family, go with God. And I'm fighting, as a feminist, I'm fighting for your right to do that and to be able to take leave and provide for your family. What I'm also fighting for is that women have the right to make that decision.
Yeah.
And that most women are going to work in their lifetime. And that is not something they have to do, but it is. So we want to make it something that they want to do, that it is fulfilling for them to do, that that it is a livable and prosperous wage and with benefits that help them provide for their family. Yeah. We certainly don't want to create an environment of policies that force people to do the impossible. Right now, I don't know anybody who could raise a family of even one child without people working.
Right. You can't raise a family on minimum wage right now. You can't raise a family on 2 minimum wages.
No.
Right now.
Yeah.
So yeah, this whole thing about the state having a vested interest in abortion and wanting to have workers, basically, is an interesting phenomenon to me, because it's, on the one hand, they want more people so that we have, you know, a functioning capitalistic society, and yet they're not doing anything to actually make that happen besides banning abortion. Like, they want the babies to be born, but beyond that, the social safety net is decaying.
Yeah.
And it was never good enough in the first place.
No. So I don't understand the logic behind it.
There isn't any logic behind it. I think they're just in their feels.
Well, some of it's in the field. Some of it is just pure white nationalism,
100%.
Which is, you know, the reason why we're seeing the move towards forced pregnancy and we're seeing the immigration crackdown is because of fears of population. And in this region, you know, the Midwest saw some of the worst racial violence in the early 1900s because of that fear. Like, there were Black workers moving in, there were riots. But ultimately, they want certain people, white women, to have white babies. They don't care as much about other groups having babies, because in their mind, all they have to do is make this profitable. So if they have privatized prisons, then having people who can't feed themselves is profitable because they're going to have to eat. If we have these low wage work jobs that are bare minimum barely keeping your head above water, then people will accept substandard social safety measures when they should be fighting for more, and everybody's exhausted. So I think it's important to remember that it's been a long time since Republican conservative policies have really dictated domestic policy. I'm old enough to remember the Reagan era, and
Yeah.
it was brutal, absolutely brutal. And people did die and suffer as a result. But I think there's a good portion of the population that thinks that if you're poor, you did something wrong. So it's kind of the same connection between if you have an unwanted pregnancy and then or an unintended pregnancy, then you did something wrong.
And that you need to pay a consequence for it.
Yes.
There's this punitive piece to it.
Yeah, yeah. So there's a vengefulness that is front and center in policy, and in a way that is so sad because I'm a strong proponent that government can enrich in people's lives and can make them better. And I think it's hard to make that case when you just see a meanness to policy that is unreal until it impacts the individual. And sadly, with reproductive health care, it's going to impact just about every American right now is going to face it in some way, shape, or form.
Absolutely. So I, post-Dobbs, took it upon myself to have a hysterectomy. I don't have children. My husband and I knew we did not want children. And because of my mom's pregnancy complications after me, I was supposed to be the oldest of what could have been 4. She had 3 pregnancy losses after me. And the idea of showing up to a hospital and instead of having my doctor get to work right away, the idea of having my doctor have to present to a board to say, here's what's wrong with her. How long do we need to wait before I can perform any life-saving procedures upon her? The idea that if I could have been right up to the point of giving birth and then I could have just died, because also beyond any pregnancy complications, women are dying in childbirth at an alarming rate. I didn't want an unintended pregnancy to take my life. And I know I'm not alone.
Not at all. Not at all. I mean, women are amazing and resourceful. And, and the reason we have the medication abortion protocol is because amazing women in South America were sitting there saying, we have to have access. We have to be able to plan our pregnancies. And they found these drugs that work together to basically cause miscarriage. And now we have this protocol that is safe and effective. But I think that there are people who are thinking through the same questions that women asked before 1973, the same dilemma that women faced before 1973, but with more options in some cases and less options in others. But we have more birth control options. We have more contraception options, but we also have, hysterectomy, sterilization options for people who know that they don't want to have a family. I think that is smart thinking. And like I said, women are amazing and resourceful.
Absolutely. Absolutely. An organization that you mentioned earlier for access to abortion pills was Plan C. I ordered 100 stickers in English and 100 stickers in Spanish, and I have been they have QR codes on them for access, and I have been handing them out to friends and putting them all over every bathroom with stickers I can find. But tell the listeners a little bit more about what Plan C does.
Yeah, so I want to talk about Plan C because they're amazing. So Plan C is an online service. You can go to plancpills.org and you can get abortion pills by mail in every state. They walk you through, this is a fully vetted website that was founded by amazing professionals, and they basically will walk you through the legal complications or any restrictions that might exist, but they are successfully getting abortion pills to people who need them in every state in the union.
Yeah. Yeah.
And then there's another thing, which is the Yuki app.
Mm-hmm.
It's spelled EUKI. And I want to say that women help women, or women, I can't remember which group, but a private reproductive rights group that has been around for a long time pulled it together because of concerns over period tracking.
Mm-hmm.
So if any of your listeners are worried about their data, then the Yuki app is for you because it is double encrypted. I don't even think the servers are in the US.
Nice.
You can get information about abortion pills. You can get information about period tracking and reproductive health care on the app. And you can talk to people in multiple languages about whatever your reproductive health questions are.
Yeah. Thank you so much for bringing up that. I was going to bring it up, but I have a keep abortion encrypted sticker on my laptop because, as there have already been cases showing that they're able to go back through your digital footprint and then bring charges against people for ordering abortion pills.
Yeah.
So you do need to take steps to protect your digital footprint. You need to maybe get like a Proton Mail, which is encrypted email. Don't use your Gmail. Don't be doing things through Messenger or texting. You need to be cautious these days, no matter what state you are in.
Absolutely. Absolutely.
Yeah, so please take steps to protect yourself online when you are looking at these things. Gosh, period tracker apps. I don't know any friends that are actually doing that anymore because they're so scared.
Yeah. Yeah. And that's frustrating. It's just very frustrating, but it's also very real because you have, states like Missouri where, not too long ago, the state health director had a spreadsheet of Planned Parenthood patients and when their last menstrual cycle was. So this isn't alarmist. It's real.
Yeah, it is. This episode is not intended to necessarily scare people, but like this is reality, and sometimes reality is scary.
Right. And I think, as somebody, and I'm sure you also heard this before the Dobbs decision, and, I had people saying I was being hysterical and I was,
same.
I was causing chaos and alarm. And the reality is that we were right, that most of this stuff was predictable. And so when I say that and you say that people need to be mindful of their digital footprint, we mean it. People are actually doing wacky things like keeping spreadsheets and trying to sue to get medical records.
Yeah. I talked to a therapist recently who got subpoenaed by the state of Missouri for her records. It was around gender affirming care, but
that's
still,
their current.
Yeah. You don't know. Like, it could even just be that you went to your primary care physician. If you have a uterus, the nurse asks you, "What's the date of your last period?" Stop telling them.
Yep.
Say, "I'm not willing to give that information."
Yeah. Unless you can say, like I do cheekily, that it was, November of 2011.
Yeah. There you go. It's been a long time. Yeah. I don't trust anything because Handmaid's Tale, I get, is a very like whitewashed version of all these dangers.
But she was right.
She was right. Would you recommend to people who have the possibility of getting pregnant these days? What do you think we all need to do right now?
I think that people who are capable of getting pregnant need to understand what laws are governing their state, and they need to understand their risk. And I use that word very specifically. So if you have, any relationship with child protective services. You need to understand the risk of somebody coming into your house and perhaps seeing medication abortion or seeing something else. If you are on probation, you need to understand the risk of seeking abortion care outside of your state. So I think, being capable of pregnancy right now means that you need to start thinking like 1965. Mm-hmm. And so who knows you're pregnant right now? That means that those are people who could have you barred from seeking reproductive health care, who could have you criminally investigated, who could, do all manner of things. And that's just real. So who you confide in about your plans, and you need to be cautious. People need to know whether their healthcare provider is anti-abortion, anti-birth control, and they should ask those questions of their health provider. People need to understand, where your information about your pregnancy and your reproductive life are. Who has it? Do you have a general practitioner? Do you have an OB-GYN? Have you told your dentist that you're on fertility treatments? All of these things now have consequences that did not exist before. And most importantly, folks need to start thinking of how they would respond to an unintended pregnancy, because the resources that you may need aren't always at your fingertips. If you live in Idaho, you're going to be traveling to get care. If you live in Missouri, depending on where you live, you're going to be traveling to get care. And that care is going to cost more money every week of your pregnancy. So understanding the rules that we're playing by, and that those rules are going to be restrictive, even in Missouri, for the time being. That if you are 14 weeks pregnant, you're not going to win an argument with a provider about getting care, because there's legal ramifications. So I think understanding that the impact of pregnancy has changed for the worse is the most important thing, because nothing breaks my heart more than when people will reach out. Still, people reach out to me and they're shocked by what the limits are. And they're shocked, that even under this constitutional amendment in Missouri, if you're 18 or younger, you can't get an abortion in Missouri without parental consent. I've had more people literally arguing with me about this than if I had $1, I'd be rich. But if you are 12, 13, and 14 years old, it's important that they understand that pregnancy up until 18, you don't get to make bodily, you don't. And you can go to war at 18, but you could not make a determination about your body.
So many irks right in there. But another thing that I think we've got to keep our eye on is them wanting to reinstate the Comstock Act. Yeah. And that is what they want to utilize to ban mifepristone and to ban the interstate shipment of abortion pills. So there's talks about it. It was part of Project 2025. But when is the alarm bell really going to raise on that specific point about them reinstating the Comstock Act? Is it just going to be we wake up one day and they go guess what?
Yeah, based on what I've seen out of this administration, my current theory is they know that their stance on abortion is unpopular. This administration is reluctant to rile up Republican and conservative and independent women. And so when you see states like Arizona and Missouri approve ballot measures, I think that's why we haven't seen anything federally on abortion just yet. I also think they're testing. They're trying to see what what will people do if they're outraged about these things? How will they respond to certain things? I've long suspected that you're not going to see a federal ban out and out on abortion. So I actually think that the fact that abortion has been proven popular in 7 states means that you're more likely to see Comstock. I think that the Supreme Court is not likely going to strike down Miffy altogether. We probably will end up going back to previous protocols, which are more restrictive. So ultimately, this president is going to reward the people who got him elected. And the anti-abortion movement got him elected. So the way I'm following it is what can he give them and what is he going to hold them accountable to? Mm-hmm. They're livid that after 50 years of saying abortion is unpopular, they're like, oh, wait, people are willing to go out there and vote for abortion. Mm-hmm. But they also have an expectation of this president, and their followers are like, why aren't doctors going to jail? Why aren't pregnant women going to jail? So Comstock, I could be wrong about this, but I have like a vivid memory of a news article about how Margaret Sanger was arrested under Comstock for birth control. So, Comstock is a mess. I think a medication abortion is unstoppable. I don't think people are prepared for who will get caught up in the Comstock ruling.
That part.
Yeah, that part is going to be different. So I know that in your head, they're thinking it's going to be teenage, Black girls or something. But, medication abortion is the majority of first trimester abortion. So if Comstock is put into practice, I don't expect them to reinstate formally. They are simply going to pretend like it's still law. And I think that's what they've been doing with...
Which I guess it technically is. It's just not been enforced. And then there's been other laws that have come along, but they can just ignore those. And ultimately, we are at a place where this regime doesn't really care about the rule of law. They're just going like, fuck you, sue us.
Right, basically. And so in that specific scenario, then the only people that hold leverage with the administration are the actual manufacturers of the drugs. So, are they going to be frustrated with, enforcement? But I think people need to have no doubt that the only determinant of whether they use Comstock is whether they think it will harm their base or anger their base, and also their donors.
Yeah. And I'm sure there's a lot of their base and a lot of their donors who love to be able to get their medication abortion supplies through the mail, because then they have privacy and they don't have anybody who can tell on them.
Yep. No pictures of them walking to a clinic, nothing.
Yeah. Of course, one of the things that is so infuriating about this whole process is that restricting abortion access, restricting reproductive health care access harms working class people. People with privilege will always still be able to have access. They will always still be able to hop on a plane or get in a car or skirt the system, find access to the black market. So,
yeah. And, until the working class and the majority of Americans, because most Americans aren't privileged. I think there's some people who think they are and don't realize they're like one paycheck away from...
They are not temporarily embarrassed millionaires.
No, exactly. So most people are one paycheck away from financial disaster, are, struggling, if not able to save for retirement, which isn't even a reality for so many people. Most people are going to be harmed by attacks on access to abortion. And for the privileged few, ultimately they will be too, because we're struggling to have people who can provide procedural care in a lot of states. So they're going to be inconvenienced. And I think immediately after Dobbs, it was the first time in my lifetime that people with means were being told they had to wait 4 weeks, the same way everybody else was. And I think it was really interesting kind of hearing these anecdotal stories about how frustrated folks were, calling all over the country. They're just like, why can't I get in to get an abortion? And they're like, welcome to the reality you voted for, you know?
Yeah.
Yeah.
It's funny how they don't like it when reality smacks them right in the face.
Mm-hmm.
So, in the meantime, how can people support medical students for choice and stay informed about what you all are doing?
Yeah, so we definitely welcome folks following us on social media. We talk about our work and we share a lot of really fun pictures of the trainings that we do in papayas. So we're on Instagram. We're also on the artist formerly known as X, and obviously Facebook and Threads and so forth.
Are you on Blue Sky yet?
Yeah, I think we are.
Okay.
I'll have to check. But yeah, we're trying to elevate the voices of medical students through social media. You can also visit us at msfc.org. And most importantly, without future providers, there is no access. So if you are able to donate and support MSFC and become a monthly donor, that would be great. We are the connection between medical students and future access. We're the only organization that does what we do, and we are always looking for support.
Pamela, this was a very informative time here. I mean, I'm a little riled up. I'm a little sweaty from anger, but like that's just how I get. I smile when I rage. I'm like, oh. So
same.
Thank you for fueling my rage today in the best way possible.
Yes.
Because when my rage is based on the truth of the matter and the truth of the situation, I feel more empowered to get out and fight.
There you go. Thank you so much. This has been a lot of fun.
Yeah, thank you. I appreciate your time today. Thanks for listening to Keep Them Coming. Please rate, subscribe, and share this podcast with your friends and lovers. Check the show notes for information about stuff discussed in the episode. You can find me on Instagram, TikTok, YouTube, and Facebook. But visit my website, openthedoorscoaching.com, if you want more information about me, my column, or my coaching services. If you want less censored content about sex and relationships straight to your inbox, and to know what I'm up to, including upcoming workshops and events, then please subscribe to the Dirty Bird email list. Send me an email, Kristen@openthedoorscoaching.com, if you have any questions, you want to book a session, or if you have a suggestion for a podcast episode or guest. My theme song is original music by M. Kusa. Until next time.